Hello, my name is Professor Kevin Hardy, and today in this presentation we're going to take a quick look at metformin. It's vitally important to emphasise that these slides are a brief summary. You should never take any tablet before reading the information leaflet supplied with the tablet to make sure that it's okay for you, because it's only by looking at the information that's in the leaflet and knowing you the way you do that you can make a judgment about whether it's suitable or not. If you're unsure, don't take the tablet until you've checked with your doctor. Metformin is the first choice tablet for the treatment of type 2 diabetes across the world. It's been around for about 50 years and it's extraordinary in that pretty much every country in the whole world uses it first line. Metformin can be used alone, or it can be used in combination with many other treatments, including other tablets, other injectables, and insulin in the treatment of type 2 diabetes. How does metformin work? Essentially, it reduces the amount of sugar that's released by the liver into the blood. It's pretty extraordinary that after 50 years we're still not fully sure quite how it does this. It's probably important to note that metformin does not cause weight gain and it does not cause the sugars to go very low. When should metformin not be used? These are a few key pointers. Again, the detailed information is in the drug information leaflet, but metformin is not licensed for use in pregnancy, but it appears safe and it's actually fairly widely used in pregnancy these days. Metformin must not be used if the kidney eGFR blood test result is less than 30. And between 30 and 45 it can be used, but with caution. Metformin should not be used in severe liver disease either. What's the dose of metformin? The usual starting dose of metformin is 500 milligrams once daily. The usual maximum dose is plain metformin, 1 gram, that's 1,000 milligrams, 1 gram twice daily, or if it's the modified release or slow release preparation, 1 gram twice daily, or 2 grams once daily. The maximum dose of metformin is less in kidney disease. In the past, higher doses of metformin were used, so there are a proportion of people who are quite safely taking 1 gram 3 times daily. This is no longer, for people who are starting it now, we wouldn't go up that high. Metformin should be started at the lowest dose, 500 milligrams once daily, and gradually increased as necessary. If it started low and built up slowly, people are much less likely to experience side effects. Metformin should be taken with food. Again, if it's taken with food, it's much less likely to cause side effects. If you suspect that metformin is causing side effects, you should stop it and discuss those with your doctor to make a decision about whether to permanently stop metformin or whether it's okay to restart it. What are those side effects? By far the most common side effect of metformin is diarrhea, which occurs in about 1 in 4 people. It's less common if you start with a low dose and build up slowly, and it's less common if the metformin is taken with food. It's also slightly less common when the modified release or slow release preparations are used. So they tend to be used in anybody who has experienced side effects with plain metformin. Metformin can also cause nausea, a feeling of sickness, or a metallic taste. And there are many other side effects which are much rarer, and they're listed in the information leaflet. It's not possible in these short presentations to cover all of the side effects of any of the drugs, and so we just pick out perhaps the key ones. What you should do is go to that drug information leaflet and study it before you take the metformin. In summary then, metformin is typically the first choice tablet for the treatment of type 2 diabetes. It's often used with other treatments, such as other tablets or insulin. It's not for everyone, and you should always check the drug leaflet before starting any tablet.